Hello, I'm Daniel Pettis, Chief Deputy of Administration for Nueces County Sheriff's Office, and this is Texas County Voice, a podcast for all 254 counties. Thank you for listening.
Hello and welcome to Texas County Voice. I'm Angela Maldonado with the Texas Association of Counties.
At Gulf Coast Center, we say we don't come to work, we come to care. And so one of the things that I say is that I make sure that I break down any barriers to our staff caring for individuals.
This episode is part of our Texas County Storytellers project, an initiative we started last year to capture and share the real voices of county officials and employees across Texas.
I'm just really excited to just provide them with really compassionate care, because there's still lots of stigma that, around mental health and people who have any type of mental health diagnosis.
We traveled to Galveston to learn how a partnership between county officials and Texas lawmakers resulted in a new mental health center. Through written features, video, and this podcast, Texas County Storytellers highlights the people behind county government, the decisions they face, the challenges they manage, and the counties they serve. The first story in this series, Galveston County's Call for Compassionate Care, is the cover story in the current issue of County Magazine, which you can read on TAC's website, county.org. Today, we're taking a closer look at how the new center fills a need the community's been waiting almost 20 years for.
So this is our front lobby. I promise you it's prettier than this. And so all the doors are secured. And so once we're up and running, we're going to have a soft launch, but once we're up and running, we will allow individuals from the community to come if they want to walk in, but they will be buzzed in because
It's early February of this year, and Galveston County Mental Health Wellness Center's newest Gulf Coast Center location in Lamarck is still under construction.
Those are others, and then security will walk them through to our intake area. But before we go to the intake area, we have some cabinets right here so they can store their belongings. We have restrooms. We also have...
That's Crystal Williams. She's the lead clinician for the center, and not only does she point out all the new building features, she's also enthusiastic that the space can become a fixture in the community.
Well, I think it's really important because we want the community to really buy into this. We are in a residential area, and so right next to us is actually the medical examiner's office, but we want to make sure that the community feels like this is also their facility too, and we're not just a long-term psych facility, because I know people are a little bit confused about that, but also for our actual center staff to know that they're welcome here too, that we will let community groups and members come and use. And so we're also going to have some of our substance use groups here, and we have consultation rooms, and so we also have like a co-working space at our entire facility. So if anyone from MCOT or some of our other programs say, hey Crystal, are these two consultation rooms open, I'm gonna have a shared calendar that they can kind of book the room to make sure there's kind of no overlap, but they can come and they can work in the facility.
Crystal spent nearly 20 years working in social work and mental health care, and this new role is a return to her roots.
I just want to tell you what I'm most excited about. So I'm from Galveston County. I'm from Galveston. I graduated from Ball High. And it's been really meaningful for me to come back to the community that literally raised me to provide care, because it's easy to go to a larger city or area, because that's what most people do. They get their degrees, and they go off someplace else. I used to work for CPS. I used to work in juvenile probation. I used to work at the hospital. I have a vast background in social services. And prior to working here, I used to work at the largest mental health authority in the state of Texas, and so it's right there in Houston. And I saw that they were opening up this facility, and I was driving over 50 miles to work every day. And so when I saw this facility was opening, I jumped on the opportunity to be able to work close to home. And we haven't had any type of psychiatric mental health facility in our area since 2008, and I'm sure you guys have heard that since after Hurricane Ike. So I was really excited that I can bring my skills and expertise. I used to work for MCOT and rapid response, and so I have a lot of interaction and experience with crisis services, working in the community. And so now all of the people that I used to work with are the population. They're going to come here at this facility. And I'm just really excited to just provide them with really compassionate care, because There's still lots of stigma that, around mental health and people who have any type of mental health diagnosis. And so being able to have people come in, individuals from our community come in and really receive compassionate care from someone who is from this area, I think is really important to me.
When Hurricane Ike struck Galveston in 2008, it destroyed the University of Texas Medical Branch's 20-bed psychiatric hospital. Before this center was built, most people needing treatment were sent to neighboring counties. The new center's design is inspired by the beach. Beige, soft blues, and greens are repeated through the meeting rooms, patient communal spaces. There's even a row of patient rooms named after coastal landmarks like Matagorda Bay and Laguna Madre. But under the calming decor, the center runs on updated tech. Gulf Coast Center CEO Felicia Jeffrey says clinic rooms are fitted for virtual care sessions, and the way nurses do their patient checks have been streamlined.
And so the nurse, because we have to do a 15-minute observation, so we have to have a nurse check in every 15 minutes. So they'll have a wearable and a nurse will have an iPad, and the only thing you have to do is just come right next to the person, their name will pop up, and you can click that visit has happened. So we're trying to make sure that we have the staff in mind, their comfort, because it's very hard to go somewhere and I need to write my 15 minutes down or enter it into the computer. And so we really do want to make sure that the individuals that we serve are comfortable in here and that our staff has the most modern equipment to make sure that their care and their comfort is also cared for. Because we like the quadruple aim. We had this place with the quadruple aim in mind. We want to make sure that we're cost effective, we reduce costs. We want to make sure that the person experience is great, and we also want to make sure that our clinicians' experience is cared for too.
Being able to build a new center means taking into consideration not only the full experience patients and staff have inside the building, but Jeffrey says this project is a culmination of how she's been able to make a difference.
So my background, I started out in this field in case management. So I started out as a case manager, and then I thought I was just wanting to be a case manager for the rest of my life because I enjoyed it. And then I had the opportunity to become a clinical director. And I said, okay, Felicia, you can impact the people on your caseload, or you can impact a whole clinic full of folks. And so that's how the journey started. So I was able to impact a clinic, then I was able to impact a region, and then I was able to impact a whole center. And then now I'm here and I can impact 2 counties.
We created Texas County Storytellers to share moments like this, where public service isn't an abstract policy, but daily hands-on work. Thank you for listening to Texas County Voice, and a special thank you to Galveston County and the Gulf Coast Center. Counties are defined by the people who serve them, and we agree. The Texas Association of Counties has launched Texas County Storyteller, a campaign aimed to collect and share the voices of county officials and employees across Texas. So if you're part of county government, we want to hear from you. Send us your story by going to county.org/storytellers or email us at storytellers@county.org. And to read more about the new center in Galveston County, visit our Texas County Storytellers project at county.org.